Spastic dysarthria. Spasticity or spasm, it means there is increased tone during rest and during the movement. How or why spastic dysarthria occurs? Spastic dysarthria occurs because of there is a damage in the bilateral upper motor neuron. So what all are the causes of damaging in the bilateral upper motor neurons? So first, if there is a brainstem stroke, it can lead to a spastic dysarthria, or if there are multiple or reoccurring stroke events, again it can lead to a damage in bilateral upper motor neurons. And then there are, if child is having a cerebral palsy, then spastic dysarthria is most common in them. And if there is a traumatic brain injury, a diffuse brain injury, again it can lead to damage in the bilateral upper motor neurons. And progressive conditions such as progressive supranuclear palsy, then amyotrophic lateral sclerosis like motor neuron disease can lead to spastic dysarthria. Let's see that what is the perceptual characteristics, or how can we make the diagnosis of spastic dysarthria on the basis of listening individual speech. So first is phonation. So all the muscles of the phonation are very tight or spastic, because of which there is slow movement of the muscle, and because of which the voice quality is become strained, and sometimes it is breathy as well. How is the articulators? Because all the muscles of the articulators are very tight, so movement become very slow. The movement is regular but it is very slow, and again it leads to imprecise movement of the articulators. And then what is the other characteristics that we should look for? So the gag reflex is hyperactive. So in those who is having a spastic dysarthria, gag reflex, we can see it is very hyperactive. The jaw jerk reflex is also elevated or hyperreflexive. Then one of the distinguishing characteristics of spastic dysarthria is that they have emotional lability, means we call it a pseudobulbar effect, means they have excessive laughing and crying in certain situations. So on the basis of these perceptual characteristics, we can make a diagnosis of spastic dysarthria.